My name's Christine. I'm the Director of Programs at Sostento, and our convening here today is to really celebrate the special impact that we've been able to accomplish with our Sostento's health access for rides at free and charitable clinics across the country and our network. So our gathering here today is really to honor the work that happens on the ground every day to make sure that patients at free and charitable clinics have equitable access to care. And also recognizing all of the innovative partnerships that have made this service and this initiative possible. Transportation, as you all know, is often times one of the most cited and also most frustrating challenges that patients face when trying to access medical care. And so through our collective partnership, I am excited to say that we've been able to tackle that head on. And we have heard countless stories from clinics across our network that patients, as well as healthcare providers, have utilized the rides to make sure that patients can get to primary care appointments, pick up their prescriptions, or sometimes take a ride to the local food bank. And so this service has been really crucial and important to make sure that individuals are connected to care and the services that they need. And so this service has really changed lives in very real ways. For our time together today, what we'll be doing is we'll be highlighting the collective impact that has been possible through all of our collective partnership. We'll also be sharing some updates as to what the future of this service looks like. And so you'll get to hear from a handful of speakers that we have for you today, members from the Sostento team, as well as the Uber Health team, NAFC, in addition to one of our free and charitable clinic leaders. And so before we officially dive in and get started with our speakers, again, just want to thank and recognize all of the clinics, your staff, your volunteers, your care teams who have implemented the service with such dedication and thoughtfulness. You all are the ones day to day making this service possible and providing care to your patients. And so it's been a true honor to work with you to implement the service. And we are excited to share more about what the future holds. So with that, the first individual that we'll hear from is Amberly, who is the Centos program manager, and for the past couple of years has really been leading and overseeing this service. And so Amberly will share with us a quick recap of where we have been with the service and help us reflect on its impact. So I will pass it over to you, Amberly.
Thank you, Christine. So I'm going to go through a little bit of the history of the rides for some of you who may not have been with us from the beginning, and so that we can reflect for those of you who have. So after COVID-19, after the vaccines had become widely available, the focus in public health at the time had shifted from vaccinating the entire public to getting those few individuals that were harder to reach and that were not able to get to vaccine appointments due to transportation barriers. And Uber was helping to provide transportation for vaccines at that time. And they brought Sostento on so that we could help with connecting them to those hard to reach populations through the free and charitable clinic network that we had built. So Sostento's health rides started at that point. And we started with 3 clinics and we did learning and development that led to a few test rides. And then we were able to increase to 5 more clinics and then to 15. I was brought on when Sostento's health access rides was at 15 clinics, and we were still using the rides for vaccine access and education. And then I was a part of expanding the ride network to 15 more clinics for a total of 30 across the entire US. So even though the public health emergency was slowing down and had ended at that point, clinics had expressed how vital the rides were to the health of their patients. They told us, that their patients needed these rides for more than just getting vaccinated, or a lot of them had already become vaccinated at that point. And we knew that the rides could have a daily and long-term impact on the patients and their quality of life if they could be used in other healthcare and human needs areas. So rides usage was expanded to any initiative that improved the health of the patient at the clinics, and also allowed health workers to provide care to their patients. So we got to see the impact of these rides from the data that we collected, and we were able to track over 44,000 rides. And these were delivered by healthcare workers to almost 9,000 unique patients. There have been dozens of ride purposes, from primary care and specialty appointments to attending job interviews and getting to school. And patients have also used the rides to receive medication and behavioral health care, attend dentists or ortho appointments, manage chronic disease, get labs and radiology, and so much more. Those are just some of the few unique and top use cases. Another notable use for rides was the over 2,500 rides that were used for healthcare worker or volunteer rides to clinics. So that is that they took the Uber rides to get to the clinic or to a clinic event or to go see the patients in their homes so that they could ensure that they were getting the care that they needed. So this, it helped the clinics staff their clinics and made sure that they had the capacity to care for their patients that were there. And 93% of rides that were provided were to patients that were living underneath the national poverty line, and 64% of riders were uninsured. So together with the mileage, just a little fun fact, the total mileage traveled through Uber rides, we have gone to the moon, and we're on our return trip. We're about 3/4 of the way back to Earth. So that's a long ways that we've all traveled together. So this data kind of gives you an idea of the scope, but the stories of impact are what really illustrate what it means for providers and patients to have these rides. One of my favorite stories was one that came through email one afternoon while I was working. I believe that we were in kind of a busy period too, so a little bit stressful with other work, and then this great story just came through the email, and it was it just reminds you of how important this work is and really like brings your focus back to the work. One of the clinics shared that the rides had helped a patient with her pregnancy journey from start to finish, and had the great news of a healthy baby being born. So that was so great. We got to have a little, pregnancy announcement and birth announcement sent to us through email. So that was fun, and I got to share that with the entire team. Another great part of the rides was getting to work with the clinics. One clinic that particularly stood out to us was St. John Bosco. They were a new clinic to us, coming from a state that we had never worked with before in Florida. And they ended up surprising us right from the start. They landed in the top 5 for most rides coordinated at 3,345 rides. And that's with coming in later, they were within those 15 expansion clinics. So even coming in later than some of the other clinics that had the rides longer, they were up in the top 5. They had 99% of their riders without health insurance, and also working with their staff was just a joy. We often relayed their tactics to other clinics of how they screen their patients for ride needs ahead of starting rides. So from day one, they were ready to go and launch rides. And I believe that's why they were able to get such a high ride volume, even though they didn't have the rides for as long of a time. And having rides available was not only beneficial to patients at the clinics, but also to clinic staff and volunteers as well. BPSOS, their clinic shared with us the benefit of rides to one of their volunteer doctors that was in their 80s, who took the rides to the clinic to care for patients. And then when he unfortunately needed cancer treatments, he was able to then use the rides as a patient to attend his appointments. So it works on both uh, ends of the spectrum, and we're just so grateful that we're able to provide these rides. Now that we are kind of going into new era of things for Sostento. I know that all the clinics have known me for the past few years as the go-to person for all things Uber. But as we prepare for the end of this phase, my role is changing a little bit. I'm still staying with Sostento, and I'm going to tell you a little bit more about the projects that I'm working on in a moment here. But as we take on some new projects, I'm transitioning off of direct Uber clinic support responsibilities. It's been an honor and a joy to bring these rides to the clinics. But as the clinics are taking on more ownerships of your accounts and you're getting into the billing responsibility of sides, it just makes more sense for you to be working directly with Uber and communicating with them for the customer support. So we also have an Uber representative on the call today with us. Her name is Erin, and she's our designated account manager. So she will be your new go-to person, and we'll hear from her later in the call. A little bit about my new work that I'm doing. I am supporting work to break down barriers to care in Mississippi. So I am taking all that I've learned from managing the Sostento Health access rides, and I'm applying it to new projects in Mississippi to address the social determinants of health and advocate for increased healthcare access for the working uninsured. And I'm also still doing some rides work. We're working on reducing transportation barriers to care and exploring alternatives to areas where Uber isn't available, like in rural areas. So that's been really exciting as well. And we've gotten to work with smaller transportation companies that can provide rides to their local areas. So I just wanted to say, as I wrap things up here, I just wanted to say thank you to all the clinics for all your hard work on the rides. It's been such an honor to work with you all, and I look forward to working with you all in the future on other projects.
Thank you, Amberly. And I think, the statistics are really great to highlight the collective impact that we've been able to share. But I also know that there are so many countless stories that, you all come across with your patients every day. So really just want to highlight the collective impact that we've been able to have working together. And also thank Amberly for her leadership and management on the service thus far. And so as she mentioned, moving forward, in terms of account support, anything like that, we will now be passing it over to the point person on the Uber Health team who will be supporting clinics with that. And so now I will welcome Erin from the Uber Health team who can share a little bit about herself, her role, and also ways to get in contact should you need any support.
Wonderful. Hi, everyone, and thank you, Christine, for the introduction. I think it's truly an honor to be here today representing Uber Health at this Health Access Rides convening and celebration. I don't think we often take a step back to celebrate all the accomplishments and successes as often as we should. So very much appreciate taking the time to do this today. First and foremost, want to extend a massive thank you to the entire Sostento team, Joe, Amberly, Christine, and I'm sure I'm missing many more names. But a big thank you for your incredible vision, dedication, and tireless work to making this all happen. And to the frontline health workers, the free and charitable clinics, and to our state and national partners joining us today, your commitment to serving underserved communities is the true engine behind our collective impact. I think this celebration is a testament to what we can achieve when we work together towards a common goal. At Uber Health, our mission perfectly aligns with Sostento's equitable access and outcomes, and eliminating healthcare transportation barriers is a key aspect in doing that. We firmly believe that a lack of a ride should never stay in the way of accessing critical medical care, nutritious food, or essential pharmacy services. And our partnership with Sostento is a powerful example of how technology and compassionate community action can really bridge that gap. So I think we have seen firsthand the success of the Health Access Rides program, and from the initial pilots launched and implemented, which demonstrated clear improvements in patient outcomes and access to care, like Amberly just discussed, to the ongoing expansion across the Centos national network. The stories of impact I continue to hear are truly, truly inspiring. I think it's really more than just a ride. It's about enabling patients, many of whom are uninsured and have low income, to take control of their health, reduce those missed appointments, and improve their overall well-being. And I think these rides are just the start of truly easing the journey to better health for so many. So looking ahead, we're really excited about the continued growth and potential of this partnership. We remain really committed to this vital work and exploring new ways to expand care for even more individuals. So the case for scale, as we will discuss shortly, is clear, and we're really eager to contribute to that future. Before I hand it over, I want to make sure everyone knows that our Uber Health team is always here to support you for any questions or concerns regarding the Uber Health dashboard, specific trips, or any technical assistance. Please don't hesitate to reach out to our dedicated support team, and I'll share that email in the chat here shortly. We're really here to help ensure the program runs as smoothly as possible for all of you. And if there's any kind of billing questions or things that support can't handle, I'll share my email as well. Thank you again for your incredible partnership and for allowing Uber Health to be a part of this initiative. We really, really appreciate it, and we're very excited about where we are headed together.
Thank you, Erin. And yeah, thank you for your and Uber Health's, continued support to make sure that the clinics are able to offer the service seamlessly. So appreciate you. Thank you very much. And so now what I would like to do is I'm going to pass it over to Joe Sostento, CEO. And for the next couple of minutes, Joe will help us share and kind of reflect on where we've been with the service, as well as, how do we look forward to continue to make sure that this service is available to clinics and their patients. So with that, I will pass it over to you, Joe.
Right. Hello, everybody. It is just such a joy to be with you all today. Let's be honest, this is not your average Zoom meeting, okay? It's not your average Zoom meeting. And it actually takes me back to 2020 when Sostento was less than a year old. And we just started having monthly Zoom meetings where we invited the health workers that we were working with. We convened and we said, we got to mobilize against this emergency. Let's do it. And it started with a few providers and partners. Maybe there were 10 people on that first call that we did, but soon we were doing virtual convenings every single month. And it evolved into something really special. For any of you who were there, we would play music, we would share stories of our success, but also of the pain and heartache we were facing. We shared updates on the ever-changing landscape with what was going on with COVID. And over the months, it became years. We did calls, monthly convenings for health workers for 2 years straight. And it's something that I remember people talk to me about whenever I meet with them as something very, very special. Because by the end, we would have hundreds of health workers who would join us and help lift each other up and endure through the pandemic. When the public health emergency ended in June of 2023, we ramped down from those virtual monthly meetings. We were tired, we were burnt out, we were exhausted, the health workers were too. But we never, ever lost sight of our mission at Sostento. And while we may have been quiet over the last year and a half externally, we did not stop working. We've been planning, we've been talking to health workers, and we've been figuring out what should we do next. So today, we get to celebrate how far we've traveled together, what we've been able to achieve in the face of crisis and unimaginable challenges, how we persevered, and we're going to say aloud what we intend to do next. But I want to start with the celebration side first. Since this meeting is celebrating people taking trips by car, and we are in the midst of summer, I thought it would be fitting to take a virtual road trip across America to shout out all the people that have made this impact happen. Because who doesn't like a summer road trip, right? So what I want to do is I take you on this virtual road trip. What I would ask is that if I shout you out, get in the chat and let us know that you're here. If I talk about someone that you know or an organization you know, and you want to say something to them, put an affirmation in the chat, okay? Because like in any road trip, I think that's part of the fun is the engagement. And listen, I won't be able to stop everywhere that this project has taken place. So please excuse me if I don't call you out, all right? But let's get going. We're going to start our virtual road trip in Atlanta, Georgia. And I was in Atlanta this past February, and it's an ideal place to start this road trip because that is where some of our first health access rides were deployed. And the first person I want to celebrate is Brianna Lathrop of the Good Samaritan Health Center of Atlanta. Brianna and her team not only helped us develop the rides model, they were one of the launch clinics. And we need to celebrate Brianna today because she has taken on a new role. She has become the CEO of Good Sam. She's taking over for the founder, and anyone who knows Brianna would know she is ready on day one to take on that job. Brianna's already got to work renovating the clinic. When I visited in February, I saw that in action. She launched their first satellite clinic in Atlanta at Atlanta's Missions Restoration House. That's expanded Good Sam's footprint. But of course, for Brianna, that's still not enough. She broke ground on a new community outreach and wellness center for Good Sam. And that is exciting to see the growth of that clinic. Brianna, if you're here or if you're listening to this later, you embody what leadership means, and we wish you lots of success in your new executive role. Keep building, keep growing. We are here for all of it. Brianna just arrived into the call, actually, so she'll have to hear that after. Brianna, you just came in. We were just shouting you out and congratulating you for your new CEO role. You'll have to listen to the recording and hear we just shouted you out. So before we leave the state of Georgia on our virtual road trip, we can't leave Georgia without calling out Donna Looper and the Georgia Charitable Care Network. Donna represents 90 plus free and charitable clinics across the state of Georgia. And this year, Donna and Sostento are celebrating the launch of our new health access program, where we're working with 5 clinics in Atlanta to build on the RIDES model to specifically increase access to behavioral and mental health care. Donna and her clinics are always there to test and try new things. That was true with the rides. That's true with our new program. And Donna, you are a rock and an amazing partner throughout Sostento's journey so far, and we are all better for it. Thank you, Donna. Okay, we're going to drive out of Georgia. We're going to head west into Alabama. It's just a few hours from Atlanta, and you're going to arrive in Montgomery, Alabama. And you're going to find the clinic that delivered the most rides during the last 4 years of our Health Access Rides initiative. So I want to celebrate Molly Stone and the team at Medical Outreach Ministries. Molly and her team delivered a total of over 6,000 rides. Okay, 6,000 rides. And just to put that in perspective for you all, that means Molly and her team, over the 4-year duration of the project, delivered 4 rides per day, every day for the last 4 years. Okay, just to put that in perspective of what Molly and her team has done. It's absolutely incredible, and hundreds of people have benefited thanks to your work of you, Molly, and your clinic. And we know that that's a community where the transportation need is incredibly high. Molly, I'll also celebrate you because your clinic just celebrated 30 years of service in Montgomery, and you're going, I think you already may have unveiled newly renovated facilities. So I know I came for a party back in 2022. I'm gonna have to come back and check out what your new clinic's looking like. So thank you, Molly, celebrating you and all that you've done through this initiative. Now, from Montgomery, we're gonna keep heading west across the border into Mississippi. And we're gonna arrive into the capital, Jackson, Mississippi. We are gonna celebrate the Jackson Free Clinic. Now, Jackson Free Clinic is a 100% student-run clinic. When I visited them, I have never seen so much action and energy with those students packed in, serving their patients at no cost to all those in the Jackson area that need it. In this initiative that we've run with the Health Access Ride, 100% of rides were ordered and coordinated by a health worker, whether that be staff or administrators or volunteers or providers. No patient has ever had to open up the Uber app or pay for the ride. That was coordinated by the clinic. And Jackson Free Clinic
Uh-oh. Sorry, everyone. Figures right in our road trip. We've got some technical difficulties. Um, let's give. Oh, Joe, I think you're
Am I
back.
back?
Yeah.
Yes, I'm back. Sorry about that. I don't know. Hey, sometimes your car breaks down, right? Sometimes your car has some issues and got to change the oil, fill up the gas tank. I'm back. Christine, am I okay?
Yeah,
So
you're good.
I left off at Jackson. I was still in Jackson. I'm still in Jackson. I was talking about the students. They're ambitious. They're tenacious, just like us. And I know we're celebrating a new crop of students who have just taken over their roles at the clinic. Jackson, we're celebrating because we are also, I announced it yesterday on LinkedIn that with the Jackson Free Clinic, we are launching a new 3-year Sostento Health Access program where we will be creating connections to social drivers of health related services. And the rides will be a big part of that. So, Jackson, and I see Katie. Hi, Katie. Welcome. Thank you, Jackson Free Clinic. We can't wait to keep growing the rides with you and through that program project we're going to be doing. We're going to be spreading to new areas of Mississippi. So, that is an exciting thing. Okay, so we're going to leave Mississippi now. We're going to get back on our virtual road trip now that we've got our technical vehicle issues figured. We're going to keep going west. We're going to go through Louisiana, and we're going to end up in the Lone Star State, Texas. So we arrive in Houston, Texas at the Ibn Sina Foundation Clinic. Ibn Sina Foundation has an enormous footprint serving the Houston population. Ibn Sina is a clinic we've worked with for many years over multiple projects. And while they were one of the late additions to the last cohort to join the program, they activated those rides really quickly. So the total distance traveled in vehicles, in Ubers, thanks to Ibn Sina, is a total of 21,969 miles. And I want to put that in perspective. That's like riding every single road in Houston 6 times over. So Ibn Sina, you've been doing an amazing job. Shout out to all the rides you've delivered. And I know that you are recognizing the need for behavioral and mental health care, and you're opening up new locations of your clinic just for mental and behavioral health. And I want to say, keep it up. We see it. We love it. Now, Texas is a big state. So before we leave Texas, we have to recognize that Texas is a state with significant need. Texas has the highest rate of uninsured residents in the country. It's around 21%. It's around 1 in 5 adults, according to recent reports in Texas, are uninsured. So what I want to celebrate in the face of that challenge is that there's a new sheriff in town in Texas to help Texans, and that is the new executive director of the Texas Association of Charitable Clinics, Paula Walker. So Paula, you're a passionate advocate. You're bringing fresh energy to the free and charitable clinics in the state. And I want to celebrate you taking on the role, and we look forward to working with your clinic across Texas in the coming months. So welcome, Paula. Okay, so we're going to leave Texas and we're going to go north, and we're going to go across multiple states to get to our next location. And it's a far distance. And on a long road trip, you don't want to go alone, right? Who wants to go alone on a long road trip? No, you need company. So what I want to take a moment to do before we get to our next location is celebrate the Sostento team that made the impact possible, because this team works so hard and it's just not always seen. So of course that starts with Christine Hong, our program director. She has been with us since the summer of 2020, and she has been the bedrock of this growth of our program and of the rise over the years. Christine, you're doing an amazing job, and the leadership is incredible. You have Amber Lee. You heard from Amber Lee. She's our program manager. She joined us from a free and tradable clinic, and she has been the driving force pushing this thing forward. I am so proud of you, Amber Lee. All the leadership you've shown, all the clinics know what you've done, but we know how much you've also done behind the scenes to make it all work day in and day out. So thank you, Amber Lee. We have to acknowledge and celebrate our Chief Operating Officer, Jennifer Estevez. Jennifer has put in countless hours on the administrative and financial side to make this thing run without disruption. Now, I want to tell you, there are a few times where a clinic unexpectedly shot up their rides and did many, many rides. There are a few times where clinic rides spiked unexpectedly. And how the system works is that if a clinic blew past their monthly rides budget, the clinic account would freeze. And that meant they couldn't do any more rides. And then I'll tell you, there was a bunch of times that this happened. And Jennifer, even if it was outside working hours, if it was a Saturday, if it was a Sunday, it didn't matter. Jen jumped on the case and made sure that that clinic account had its funds and then make sure that no clinic would miss their appointment because the ride couldn't get made. So rides literally would not be happening without Jennifer. And I know she's along for this road trip because she's literally done it before in real life, driving on a road trip to clinics. And really, that was a concession for Jennifer because she is from New Jersey, and that's the only state where you actually can't pump your own gas. So she left the confines of New Jersey to go visit all the clinics, even if it meant she had to get out and pump gas. In 100-degree weather, I mean, I understand. Like, who wants to get out of the car? Um, so Jennifer was also supported by another Sostento team member named Lamise, our finance officer. And I'm telling you, it's tricky with rideshare. It's a variable cost. Uber rides can have different costs depending on the time of day, if it's raining or not. And we had to keep track and reconcile all of the budgets across 30 clinics. And every month we had to make sure those payments were covered and tracked. And Lamise with Jennifer took on that Herculean task and made sure every single ride and every single dollar was accounted for. So there's still more people behind the scenes at Sostento I want to talk about. Chris Hansen. Chris is Sostento's data engineer. He's the tech bedrock at Sostento. Not only did Chris help us with the design of the rideshare approach of how we were going to get this done from the very start, but he has built the incredible data system that allows us to track our impact, to make sure it's equitable, to monitor clinic budgets, and more. There's just so much that you don't see that Chris has done for this project. I mean, for me, sometimes I wonder if he's maybe cloned himself with AI because I don't know how one person has done it all. And so, Chris, thank you for all the effort that we don't see because we know how important it is that we can see this impact, we can track it, and thank you for all that data work. Few more. Also on the Sostento road trip would have to acknowledge Mira Kim. Mira is another Sostento team member. She's our design manager. She helped develop our approach and is now leading the design of how we maximize rides for behavioral health. She's done countless interviews, focus groups, research with all the health workers and more to inform the model. So thank you, Mira, for everything that you have done. John Bone is our communications manager. So John keeps us on message as we talk about these rides. He's assisted us on storytelling, awareness raising, and we would be totally invisible if not for John. So thank you, John, for making sure people know about the rides and we can do these communications to highlight it. Lastly, I want to shout out, we have 2 new Sostento team members. So for the first time in 2 years, Sostento has added new team members, and they are Jane Ann and Barath. So they are, I believe, both are here with us today, and they are going to be working on the front line, helping to coordinate and grow our capacity to do rides within our new program. So I want to welcome both of them. All right, so we've gotten now, like I said, we're driving from Dallas, Texas, all the way up north. So that took a little while, but we shouted out all the Sostento people, and now we're going to arrive into Wisconsin. And Wisconsin is one of the states leading the way on our rideshare approach. And I'll tell you this, as we start our celebrating in Wisconsin, you cannot have a free and charitable clinic celebration without Sarah Nichols, the executive director at Open Arms Clinic. During the project, Sarah and her team have delivered over 3,500 rides. That's the most in Wisconsin. And 99% of those people who've taken a ride live below the poverty line. That's a stat worth admiring. Sarah was also highlighted in an Uber TV commercial, and her face was on Uber billboards across Milwaukee. That's pretty cool, isn't it? That's worth celebrating. And anytime I had a question and wanted to get an insight about rides at a clinic, I called Sarah, and Sarah picked up the phone every single time. It didn't matter if she was in the clinic and busy or if she was taking her son on a college site visit, she answered the call. So thank you, Sarah. And before leaving Wisconsin, we have to shout out and celebrate the team at the Wisconsin Association of Free and Charitable Clinics. We are always benefiting from the fearless leadership of Dennis, who leads up the Wisconsin Association of Free and Charitable Clinics, as well as Courtney and Shelby, and I think they're all here on the call. So I want to celebrate your all tireless work, increasing visibility of the clinics, mobilize funding for the network, and helping advise Sostento as we grew this initiative. Well, now, all things have, good things, road trips have to come to an end, but we're going to take a short trip to our final location, and that is Chicago, Illinois. And I first want to celebrate Community Health. This is the largest free and charitable clinic in the nation. They were part of the earliest design and helped shape the approach. I want to shout out their executive director, Stephanie Wilding, who this year was appointed by the mayor of Chicago to serve on the Chicago Board of Health. It's pretty cool. We're also excited to have community health as part of our new health access program. And we were working to expand the ride for behavioral health and mental health purposes, just like we are in Atlanta. And we're building something very powerful. So I'm thankful to have community health involved. So our last stop on the road trip, we remained in Illinois, but I saved my final shout out and celebration for the most meaningful to me today. And that is to celebrate the Illinois Association of Free and Charitable Clinics Executive Director, Melissa McGuire. I've worked with Melissa and her team on countless projects over the years. She's brought me so much wisdom and positivity to what we do. And I received news just yesterday that Melissa will be stepping down as the executive director of the state association this fall. And anyone who knows Melissa knows she has already left an incredible mark on free and charitable clinics, not only in Illinois, but nationally. She secured the first ever appropriation of free and charitable clinic funding from the state, which is now entering its fourth year, and has mobilized funding totaling $31 million for clinics in her state to expand and innovate and deepen their impact. So the month of August is decreed as the Free and Charitable Clinic Month in Illinois by the governor, and I'm going to be there. I'm coming to Chicago to celebrate and to spend some time with Melissa and personally thank her for all of her service. Nobody I have met cares more about clinics and their health workers than Melissa. Every question or idea I ever bring to Melissa, it's all, and this happens a good amount, she always anchors in it, what's best for the clinics, Joe? What's best for the clinics? And so thank you, Melissa. We wish you the best as you transition out of your leadership role. So that's the end of the virtual road trip, and it's been awesome. And I wasn't able to mention everyone. There's many more I could have talked about. So I want to say that we've finished the virtual road trip, but that is not the final destination for what I have to share with you all today. So it's time to get a little bit more serious now and speak aloud intentions for the future. And so I want to start by sharing a truth, which is the way that we deployed rides over the past 4 years, while it delivered incredible impact, it was pioneering and innovative, it just was not set up to scale and it wasn't sustainable. Every ride we delivered from 2021 was made possible because of philanthropy. And I want to shout out the team at Uber that assisted with that philanthropy. Abhinav and Lior, I believe you're both here. Because of your efforts through a combination of mechanisms and with the help of the Local Implementation Support Corporation, LISC, you all helped us cover the cost of the rides, all 44,000 rides that we've delivered. Now, on top of that, I mobilized philanthropy and leveraged government, foundation, and corporate support to cover all the Sostento costs. Those were not all fully visible, but they are measured in the hundreds of thousands when you add up all the staff time, trainings, accounting, and more. So at the end of last year, when we were thinking about the end of this phase, and I realized that this was not sustainable and not scalable, I met with Uber and we agreed we needed to look at a different model, a new sustainable and scalable model. And it was simply because the need was growing and our model was not going to be able to keep up with the need. So this is the intention I'm speaking now, is that we need to develop a new model that's sustainable and scalable. So what does that mean? In terms of sustainability, we need a model that enables clinics to cover the cost of rides that their patients need, and we need them to do it themselves. So while I'm putting out the intention that we will need to ask clinics to raise their own money for rides, they need to be affordable. Not free, but affordable. And we need to find a way to reduce the cost of those rides, either through subsidies or discounts or fundraising. We need to do it. We also need to cover the costs related to Uber running its platform. That's not just the technology, but it's the customer support and administration we'll need. So without that, the whole thing doesn't work or sustain. It breaks down. We also need to cover the cost of Sostento's implementation services. We backstop the clinics. We get new clinics going with trainings, deployment support, data collection, capacity building, and more. So what we're going to need to do in terms of sustainability is we need a model that covers the full implementation costs so that clinics can become self-sufficient in deployment and that there's targeted Uber and Sostento support to make it happen. So that's the sustainability. Now, in terms of scale, as hard as we tried with our model over the past years, we could not grow past 30 clinics. And that wasn't because we didn't have the clinics that wanted it. It was because we could not raise the funds to do it. So meanwhile, we have many clinics and providers contacting us all the time. And what this really says is that we have a moral obligation to figure out how this scales. Because just in the past month, Christine and I had at least 3 clinics come and ask to be added to the waiting list that is already really long. So we have a moral obligation to figure out how this scales. And that means making the change to our model and asking each stakeholder to contribute so we can scale. Now, in a bit, you're going to hear more about how we intend to scale or from what reach with the National Association of Free and Charitable Clinics. They have become an incredible advocate and champion for what we want to do in terms of unlocking scale. And so you'll hear from Nasty in a little bit more about the scale and reach that we can do. And scale, like sustainability, will require contributions and compromise. The moral imperative, like I said. So Uber, we need your help. We know there's the platform, but the resources, we need you to dig deep. I know we're not in a public health emergency anymore. And I know you have bottom line quarterly goals, but there is a crisis coming with the cuts to Medicaid. And there are going to be millions of new Americans who have an emergency because they can't reach their health care. Clinics, like I said, to reach scale, we will need to ask you to raise some of your own funds to cover the cost of rides. And that will allow us to expand and concentrate new resources to clinics that have not yet used the service and require more startup support. State associations and other stakeholders on the call, you can help us with advocacy and securing new partners to resource the growth. And for Sostento team, we see scale pushing us to set an attention around removing the transportation barrier to care for as many patients as we can reach. And so where Uber does not cover or cannot cover, especially in the rural areas, we will seek alternatives and innovative new solutions. So today is a day for intention. And before I pass it back to Christine for the rest of our speakers, I want you to know what I'm doing today. I'm taking immediate action to work on this sustainable and scalable model with an eye towards the immediate needs as well. In an ideal world, I would say, hey, I'll see you in a year. We're going to figure out how to build this new model. But I know we can't do that. I know you have needs, and the needs are real today. So we are going to build this new model while we fly the current one. And we move forward with the openness and mindset that change is coming. So in closing, I'm humbled by what all of you do every day, and know Sostento will be working, even if you don't see it, towards something that will rise up to the challenges that we're likely to face ahead. So Christine, back over to you.
Okay, thank you, Joe. And like Joe mentioned, we're going to go ahead and pass it straight on to Ariana from NAFC. So Ariana, the floor is yours.
Thank you so much. First of all, my name is Ariana Gordillo de Vivero. I'm the Senior Director of Strategic Initiatives for the National Association of Free and Charitable Clinics. And good afternoon. I am absolutely honored to be able to join you today for this important conversation about the future of access and equity in healthcare. As we all know, across the United States, there are over 1,400 free and charitable clinics that are serving as a safety net for millions. Last year alone, clinics serving 1.7 million people through over 6 million patient visits. That's huge. This is important care. This is vital care to the uninsured and the underinsured individuals who often fall through the cracks of our broken healthcare system. These clinics, those of you who are on the line now, you know very well that you are reaching members of our communities that are managing multiple jobs, that have caregiving responsibilities, that have language barriers, chronic health conditions, and all without the ability to pay or access. And yet, for all of our patients, well, I would say for many of that, almost all of our patients, getting to the clinic is half the battle. And so for the communities that we serve, this challenge is even more magnified. Um, According to the American Hospital Association, more than 3.6 million people each year miss or delay medical care because of transportation barriers. Our patients have it even worse, basically. Lack of a car, lack of public transportation or simply not being able to take time off of work, for example, can make healthcare feel quite out of reach for them. So this is why I am thrilled. And Joe, thank you for letting me make this announcement. I am thrilled to announce that Uber has donated $100,000 in ride credits to be able to support free and charitable clinics participating in this transportation initiative in partnership with Sostento. Now, these ride credits are being used to provide free transportation to patients, as you all know, helping them get to essential medical appointments, whether it's a follow-up visit, prescription, refill, screenings, and such. And the clinics um, have been selected to be able to receive assistance with ride credits for the sustainability based on patient volume, documented transportation needs, readiness, and really Sustento was able to help with getting support where there was the greatest need and potential for impact. So this incredible investment from Uber has truly helped alleviate and is helping to alleviate urgent care access challenges. And I believe that it is creating momentum toward building a more sustainable future for transportation access. So, looking toward the future, as Joe just mentioned, we really want to be able to build a sustainable and equitable program. That is important. That is at the center of everything we do, equity. And so, this partnership is not really um, about just a one-time gift. It's about reimagining transportation as an essential part of a healthcare journey. We're going to be using, and we are using, I know we have seen, especially with a lot of the clinics that have been shouted out, stories, outcomes, data from this pilot to make the case for long-term sustainability. The goal here is to show whether it's funders, policymakers, our communities, that transportation is a cost-effective way to improve care delivery in this country. And so together with Sustento, we are committed to growing this program. We want to make sure that we can bring it to more clinics. We want to make sure that it is sustainable. And we want to make sure and ensure that no one misses care because they can't get there. And so I know that we went through and were able to celebrate, but I do want to kind of take the 50,000 foot perspective here for just a moment as the National Association. And I want to celebrate the incredible progress that you all have made so far, each and every one of you, especially those that are able to join us today live. From what I know, there have already been over 44,000 rides delivered through this incredible initiative. And each one has been ordered and coordinated with a Sustento trained healthcare worker at a participating free or charitable clinic. That means over 44,000 rides through 212 different clinic staff for over 8,800 unique patients in 30 different locations covering 15 states in the nation. That is huge. That's the kind of scale that demonstrates both the need and the success of the approach. I think we all have to take a moment and kind of process that. Our clinics, and you all know this very well, our clinics are reporting fewer no-shows. Patients are expressing relief. They're expressing gratitude. The care teams at our clinics are finding it easier to be able to manage follow-ups and continuity of care. We're also seeing some clinics expand hours. We are seeing an improvement in efficiency. We are seeing uh, strengthened relationships within the community, relationships with our patients as well, simply because transportation is no longer a barrier. That is incredibly important. So, on behalf of the National Association of Free and Charitable Clinics, I want to thank Uber. I want to thank Sustento for helping us drive health equity. both literally and figuratively. We're celebrating a powerful milestone today, but I'm more excited for what's to come, frankly. Let's continue working together to make sure that healthcare is truly accessible and equitable. Thank you.
Thank you, Ariana, and appreciate the partnership that we know is going to continue to blossom as we look forward to the future of the service. So thank you. We have one last speaker on the list today, and for that, I'm actually going to pass it over to Joe for an extra special announcement and also to introduce our last speaker.
Yes, thank you, Christine. And thank you, Ariana. Just so you all know, Ariana, they represent, I believe it's 1,400 free and charitable clinics across country, and we have 30 today. And so that tells you a little bit about the imperative we have to reach more of those clinics. So thank you, Ariana. You always bring the passion. You are an advocate. You're a champion. You and Nicole and the whole, and I think Molly's here as well from the NASU team. We appreciate you. And we're so excited about our partnership to help scale this and make it sustainable. So appreciate it. But I'm back on the stage because I have a special announcement to make. And this is regarding Sostento's board of directors. And so when Sostento was founded in 2019, the board was made up of folks with public health expertise, innovative thinkers to help us start up. We shortly added some folks to help us with the opioid response efforts. And then we hit the pandemic and we just went full steam ahead and we kept our board. But in 2024, our board set up an intention that we needed to make a change. We needed to set up a new 5-year plan for the organization, and we needed to determine what a board would look like to drive us into the future. And as we did that, we realized that we were missing a board member to represent the core constituency that we serve, frontline health workers, and in particular, the constituency that we've worked with over the last 5 years, the most, free and charitable clinics. And so late last year, I believe it was, or maybe it was early this year, I received a letter from a clinic leader who inspires me. We were actually in a CNN story together about the work we did on vaccine access with the rides out front with Erin Burnett. I'll never forget that. And so the letter said she was leaving the clinic after over 20 years to move into the philanthropy world. And I saw a perfect opportunity. So today, I am proud to announce that on August 1st, Sostento will be adding its first new board member in 3 years. And that board member will be Marisol Resendez, who knows the free and charitable clinic world so well because she has lived it. So I'd like to actually invite Marisol up to say a few words. So Marisol, please.
Thank you, Joe. Thank you so much. Hi, everyone. I am so happy to be here today and, see everyone, Christine and Joe and Amberly and the whole Sostento team and, Uber. So I wanted to kind of start a little bit and tell you all a little bit of how we started or our relationship started with Sostento. And pretty much like Amberly mentioned and Ariana mentioned, it's very similar, and Joe also touched on a lot of it. So just bear with me a little bit and I'll tell you our story just real quick. But it began during the height of the COVID-19 pandemic, of course, and at that time, Sostento was identifying clinics through the National Association of Free and Charitable Clinics Network. And they had learned, obviously, what we all know all too well, right? That transportation was the #1 barrier to accessing vaccinations for uninsured and underserved populations. So when I heard that they were looking as far south as our valley, our RGV, all the way on the border with Mexico, and to partner with El Milagro Clinic. Also, shout out to Maggie, the new executive director at El Milagro Clinic. She's also here on the call and doing a great job. But I was overjoyed when I heard that they were looking our way. A lot of times, I feel like people forget that we're here, that the valley exists, and so Joe and Sostento really just saw us, right, and saw the need. So, and that speaks a lot to what Ariana said. It's not just about proximity and the big cities and metro areas, but it's about equity. And Sostento had that very clear from the beginning. And I think they were very strategic in the way that they picked some clinics and the way that they've expanded. So since then, of course, the rights program evolved beautifully to not just only do, COVID vaccines, but also provide the rights to support access to medical appointments and picking up meds and the lab services, counseling sessions, and even nutrition education for some of El Milagro patients, of course. And these are all essential services and pillars in just managing the chronic conditions, and just supporting long-term, just well-being. This next part, though, it's so important to me, and I want to make sure that I mention it, and that I'm very clear about it. In all my time at El Milagro, and like Joe mentioned, it was over 20 years. We had never seen anything work quite as well as Uber Health did for our community. We tried bus vouchers, and we have a bus stop right in front of the clinic. And our public transit system, though, here in South Texas is quite limited. And so the routes are sparse, and it's often just a long and inconvenient process for especially, the patients that are juggling different things in life and childcare and even mobility issues. And so time and again, those efforts fell short. But Uber Health met people where they were, and it really did work. And although I know Joe mentioned just now that it wasn't scalable the way that it was, this model really works. And so the impact was, during my time there, that I could witness, right, and continues to be profound. We saw patients show up to their appointments when they otherwise wouldn't or would miss them, right? We saw more follow through on referrals, and we saw improved continuity of care. And so these were so important to us at El Milagro, because it was one less thing for them to worry about and for us to worry about. And that was so just good to know and feel that was one thing, okay, we got that covered, we got the transportation, you can come, we'll send you an Uber. So the transportation still remains, though, one of the biggest barriers in our region. But now I think that we've seen firsthand just what happens when you remove it, right? And so that's just, it's amazing for me. Every time I think about it, it's just, I feel so good about it. So that's why I've made it a point, right, to share this solution from the beginning with local stakeholders, and there is a growing interest in scaling it. The success at El Milagro has caught people's attention, and I truly believe that this model, the new one that we're making scalable, can and should grow to serve other clinics and other communities like ours. And so, which brings me to the next point, because I'm incredibly honored and grateful to be joining the board. And as someone who has lived and worked at this intersection of health equity and community care, I really do see it as an opportunity to give back and just contribute in any way that I can, but also to help move this work forward. And so, I'm here and ready to help build bridges between clinics like El Milagro and the resources that Sostento can bring, and Uber Health, and whether it's through strategic partnerships or just storytelling, identifying areas, that could benefit from this work. I'm so excited to be, just an advocate and a connector, and ensure that no community is left behind. So thank you so much to Sostento team. Thank you for thinking about me. I am so grateful and honored, really, and to our partners at Uber Health, and to everyone who continues to prioritize this work. This initiative is more, just like Ariana says, more than just rights. It's about so much more. It's about expanding opportunities and really closing the gaps that keep people from living their healthiest life. So thank you.
Thank you, Marisol. You have been a leader at your clinic, through this pilot, but we also are grateful for your continued leadership, as we see kind of the future of the service unravel. So appreciate your perspective and your advocacy, continuing with our team. You'll notice the time. We are just about to wrap things up here, but as always, so great to hear from all of the clinics, all of the stories of all of, patients whose needs are being met, they're being connected to care, all of our partners. and all of the collaborative partnership making this all possible. So just to wrap things up, I want to say thank you to everyone so much for joining today. While we may not get as many opportunities as we did in the past or during the pandemic to come together and celebrate, I really hope that today's, convening was a chance to celebrate, reflect on where we have been, but also re-energize for where we are going in the future with the future of this service. I also want to thank all of the speakers that were part of today's celebration and for sharing all of their perspectives. I think we really reinforced on the call today that something that we already know, but when partnerships and collaboration, we're able to come together, we know that we're able to remove, some of these really challenging barriers for patients to access really important care. Especially want to thank Uber Health for all the support along the way and making this service possible, NAFC for your partnership and ongoing support, and maybe most importantly, all of the clinics, your staff, your volunteers, the students who are working at the clinics for making this service possible. Every ride has been made possible because you went on the Uber Health dashboard, you worked with us, you scheduled the ride, you managed the ride, you made sure that the patient got into the car. So thank you so much for the work that you do day in and day out, and especially for making the service possible. The last thing that I would like to share is that Sostento will be having another event later this fall in October. That will be another opportunity to come together, share what's been happening, and we expect to be able to share some organizational and programmatic updates. So stay tuned for more details on that. But just want to thank you all again so much for your efforts in making this all possible and the celebration all possible. We really, treasure the opportunity to celebrate with all of you today. So with that, thank you so much. Take care, and we hope to see you all soon. Thank you.